Hello! Natawa ako dun sa bagong intro namin and I hope that you like it. Magandang hapon po. Actually, malapit na po bang maging good evening and we have been busy today because today po is the birthday of Dr. Jason Sago. Otherwise known in this family as Dada. So, birthday po ni husband. So, we were so busy po fixing yung mga pagkain niya, yung pinamimigay po natin. And we gave away thousands of melon. So, that's very exciting. So, sa inyo pong lahat, thanks for joining us today kahit late. And we'll just do na lang po a Q&A to accommodate all questions. So, ako po, Dr. Ana York Bondoc. I am a pulmonary specialist from the University of the Philippines. Follow us on YouTube. Again, Dr. Ana York. Like and subscribe po kayo. At sa Facebook also, please follow us. You can ask questions. We will try our best to answer them this afternoon po. COVID and non-COVID, very welcome po lahat. Okay? So, let's start. Lagay lang po sa baba yung inyo pong mga tanong and let's go. Sa mga gustong bumati ng happy birthday at saka may nagpapabate. Miss Kat, sino ba yung nagpapabating kaklase mo? Let's greet her first. Okay? So, mga questions po. Miss Kat, sino nagpapabate?
Ayan, nagpapabati po yung kaklase ko, si Noemi Manansala Deyang po from Apalit po.
Mimi Manansala Deyang from Apalit, kumusta ka? And thanks for tuning in. May binanggit pang okasyon si Mimi?
Noemi po, Noemi.
Baka birthday din. Noemi. Okay, Noemi.
Yes po, nagpapag-greet po siya ng video greet. So, maybe next time mag-video greet po tayo ng i-record ko po kayo.
Walang problema. Okay,
yes,
Noemi, we will video greet you.
She is your number one fan.
At birthday mo si husband. Wow. Super.
June pa lang.
Okay, sige. Yeah. We'll give you a birthday greeting, Noemi. We'll also give you a birthday virtual checkup kung gusto mo. Ayan. So, sige. Next.
Is Ate Reyna here na?
Ikaw na lang, Kat.
Sige po. Okay, our first question po. Doktora, after vaccination, 2 doses, okay na ba along lumabas?
Nako, talagang number one tanong yan, ano? Kasi, why? Kasi, syempre, tagal na ho natin na maraming restrictions. And now that we have been, some of us have been vaccinated, that's the number one question. Pwede na bang lumabas? Okay. First of all, when is the complete protection of the vaccine? Maabot po kayo ng 90% of safety from death, serious COVID, or hospitalization 22 days po after the last shot or the second shot po, no? So ako po, I was April 9. Ilang araw na ba ako, Kats? Today's April 22. So wala pa po akong 22 days. But 22 days after, you're supposed to be completely protected already. So ano ho ba yung protection na yon? Well, that protection mentioned po death, hospitalization, and COVID, ano po. But the question is, can you now go out? And siguro, another people thing that people wanna ask is, can you go out without a mask? Well, ako po, no, yes, you can go out. Definitely you can go out, but you need to wear a mask. Why? Kasi po, yung 90%, yun po yung hindi kayo mamamatay. Pero yung possible pa rin ho kayo magka-COVID, okay? Possible rin ho kayo magkaroon ng mild COVID. Pwede rin po kayo makahawa ng tao. So you definitely need to wear a mask, okay? Lalo na if you are living with people who have not been completely vaccinated. For example, frontliner kayo. Tapos yung tatay nyo ay ayaw magpabakuna. 80 years old na po si tatay. So definitely po, kailangan pa rin ho kayo mag-ingat because you might get COVID and you might bring it home to your house and 80-year-old daddy did not get vaccinated or refused to get vaccinated. So baka may mangyari po kay tatay. And of course, nakikiayon din po tayo with the majority of the Filipino people. Kasi parang, well, mainggit sila, lalo na yung ayaw magpabakuna, no? But I think may surge pa po tayo. So let's still be cautious. But at least we are confident po that we have the 90% protection against death, hospitalization, and severe COVID. But again, it's better to be careful. Kung lalabas po kayo, always wear a mask and always socially distance with your face shield. Okay? So salamat po and Thanks for asking that question. Maraming nagtatanong niyan, lalo na po yung mga bata. So advice ko, pwedeng lumabas, but mag-ingat pa rin. Okay?
Okay, next po. From Mr. Lanlan Messia. Hi, Doc.
Hi Lanlan, kumusta ka? Good evening.
From another viewer po. Doktora, should we measure antibodies and what test?
Isa pang ano yan, kahapon lang po kausap ko yung pinsan ko. Ang sinabi niya po sa akin, ang plano niya po is after his second dose, he got Sinovac. They plan daw to measure their antibodies para malaman po nila kung marami na po silang antibodies versus COVID. So marami ho may plano niyan. And the question is, dapat bang gawin yan? And will it give us useful information? Okay, let's start. Bakit nga ba antibodies yung i-measure natin? Well, because when we get vaccinated po, parang there will be an antigen formed. Whether it's an activated COVID, basta mabubuhay po yung immune system nyo, parang makikita niya po yung binakuna sa inyo. Whether it's the inactivated na patay na COVID, whether it's DNA or RNA, malalaman po ng katawan nyo that there is a foreign object that entered your body. Okay? So that is considered the antigen. Ngayon, your body in reaction sa blood po ito, no? In reaction to the antigen, your blood cells, WBCs, white blood cells, they will form antibodies to the antigens po that they have detected. Those antigens were the ones na pinasok po sa bakuna. Okay? So we are supposed to form antibodies. Okay? So that is the basis for the question, like, should we measure antibodies? Kasi kung ang theory po, kung marami na po tayong antibodies, then marami na po tayong panlaban sa COVID. Ano po? But that is not po what we are supposed to do. It's also not going to give us useful information. Why? Kasi does it mean na kung bababa yung antibody? Well, if you have many antibodies, that's good. Okay? Wala namang masama doon. But the next question is, kung mababa ba yung antibodies mo, does it mean that pumalpak po yung bakuna? Or does it mean po that you need to get a new bakuna? Ganun ba? So that information po, we still do not know what that means. So if you measure your antibody and it turns out to be low, it doesn't necessarily mean that you need to rush off and get another bakuna. Hindi po, no? Because as we have found po, in those people who naturally got COVID, there is a time po na bababa po yung antibody levels nila. But there are fighter cells po in the body, like the B cells and T cells po, which are also formed by the WBCs. These are what we call memory cells. And they remember that once upon a time, an antigen entered the body. Okay, and that antigen was named COVID. Or merong foreign invader, sabihin na natin. And that foreign invader was named COVID. So the next time you let's say, may bumahin, you inhaled it, then the COVID na nga entered your lungs, the memory cells will remember, okay, and they will say, aha, nakita ko na to, and this yung nakita ko dati, that is an invader and not part of the body. So lalaban po si memory cells. And they can actually kill po the COVID that will enter your body. So it's not only po antibodies which matter, but memory cells which we cannot measure po from an antibody test. So should you get an antibody test or to find out how many antibodies did you form after COVID, first of all, the antibody tests, even the best ones, are not totally reliable. They are not supposed to quantify. Kasi po, it doesn't really, mahirap pong sabihin na dahil marami, okay ni. Pwede naman hong not so many, pero matatalino yung mga antibody nyo. So, kaya na po, no? And the data po is still not there. So, what could I suggest? After 2 weeks, after 2 doses po of the vaccination, relax lang po, okay? Scientists have done lots of studies on this. You are already protected. Ngayon, Of course, wag naman susugod ng mga walang mask at bahala na si Batman attitude, ano? Still continue to be careful because you can still get COVID. And again, the protection is 96 to 98%. Pero wala namang 100. So baka may mangyari pa rin ho sa inyo. So ingat pa rin, okay? And later on, we will wait po for more data from scientists, whether okay na ho yan forever, for life, whether we will need booster shots. Remember, the flu is every year, or whether we need it every 10 years, like the tetanus shot. Okay? So after you have been vaccinated twice for COVID, there is no need, and also it is not useful to get an antibody test. All right? Salamat po. I'm accepting non-COVID questions, ha? Kung may tatanong lang po kayo, personal to you, maybe your husband or whatever, family members, please put them down. Okay?
Okay, thank you po. So, all questions are welcome po. Just comment down below po. From Mr. Ken Laksamana, hello po, Doktora.
Hi, sir. Good afternoon.
Another question po. Doktora, obese ang anak ko. Concern po ba yun?
Ay, nako. Yes. And what's the meaning, why, and how did we find out about this? A lot of people have been messaging me privately, and ayoko naman pong magsalita ng pangit, no? About those. But some people said, Doktora, namatay ba siya dahil mataba? And I'm not here to discriminate against obese people, but I'm here just to tell you the scientific truth. Yes po, it's really a problem. Kung talaga kung malaki yung anak nyo, and I mean, how do you measure obesity? It's from the body mass index po eh. They will measure your height and weight po, no? And then titingnan po yung inyo pong there's a number, and marami na hong calculator dyan sa internet. Lagay nyo po yung height and weight nyo, malalaman nyo po kung obese kayo. If you are more than 140, the number, may problema na po yun. Okay, so let's go. So that's how to measure obesity, okay? Number 2, what's the point of obesity? Studies have shown that the number 1 predictor po kung magiging serious po yung COVID nyo or mamamatay po kayo, the number 1 predictor is age. Okay? Kung matanda na po kayo and that is over the age of 65, normally, kung walang surge 10%. Pag may mga surges, mas malaki pa po sa 10%. Ngayon, if you're very young, like 20s, children, ganun po, your risk is less than 1%. Okay. So it's good to be young, but it's not good to be young and obese. Kasi the second after age is obesity. And notable po ito sa mga younger persons. Ang namamatay po are obese younger persons. After old persons, obese younger persons. Notably, male obese younger person. So, that is also the reason why obesity was made one of the comorbidities. So, A3 po yung inyong anak. What's the meaning of A3? Pwede na po mabakunahan. Kasama po siya ng mga hypertensive, diabetic, cancer, neuro, stroke, heart disease. Tingnan mo, yung obesity nasama sa mga yon. So, talagang obesity is really bad for people with COVID. So, ma'am, kung yung anak niyo po ay 18 and above and obese, he or she is part of the A3 category, and ipalista nyo na rin po yan for a vaccination. It is going to be a big problem po kung ma-COVID positive po yan. Okay? So, sa mga kain ng kain, this might be a reason for you to start losing weight.
Okay, next po. Another question from a viewer po. Doktora, bakit inuuna ang mga matatanda? Hindi naman sila lumalabas ng bahay at parang marami rin ang ayaw na lang. Maybe sa vaccine po yan.
Yeah, so ang sinasabi nila is a lot of elderly persons are not in favor or don't want to be vaccinated. Actually, that is the truth. Okay? Marami na po akong naikutan. I live in a barangay. I've spoken to a number of barangay chairmen. And kami rin po ang tumatawag po ng mga tao para po mabakunahan sila, no? And I'm sorry to let you know that a lot of those people po who pakilagay lang seniors and vaccination. Okay, as the heading, take out my name and put seniors and vaccine. Ganon. Marami po talagang seniors na naghe-hesitate magpabakuna. Okay? And marami pong mga bata, younger working population who do want to get vaccinated. So the question is, ba't ganito? Um, well, kung bata ka kasi, can you imagine naman, you're wasting your life staying there in your house? Imagine kung wala kang asawa, paano ka maghahanap ng jowa? Okay? If you have a job, if you want to continue your studies, of course you want to travel. So as a young person, there's a lot to live for. Pwede ka pang magkaanak, pwede pa kayong magbakasyon ni Mrs. How about the kids when you go to the beach? And there's a lot of living to do po for younger persons. So talaga pong they would like to be vaccinated. Para matapos na po to and they can move on with their life. Kaya lang, um, a lot of the older ones din naman po, sometimes medyo mas conservative, ganun po, doon na lang po sila sa bahay. But what I could say po, if you are elderly, I would suggest that you look into it kasi mataas po talaga yung death rate nyo, 10%. Even if you stay home, halimbawa po yung anak nyo, yung delivery person ng pagkain, yung inyo pong kasambahay, yung inyo pong driver, yung inyong tita, tito, and those leaving the house, they can easily bring COVID into your house din po and you can get COVID even if you never leave your house. And the most important thing that I would like to say to seniors is, tapos na ba yung buhay nyo? Ayaw nyo nang lumabas? Don't you guys want to eat out in SM? Go to the, for example, religious si nanay. Ayaw nyo bang pumunta sa mga religious activities, mag-prosesyon, join the Holy Week. What, you're gonna stay there in your house for the next 10 years? Parang hindi. And if you are a guy naman, ayaw mo bang makipag-inuman? But again, I cannot force seniors to get the vaccine po eh. Seniors are now okay to get AstraZeneca and Sinovac. So, tama rin po yung tanong marami rin hong nagsabi sa akin, why don't we vaccinate yung may gusto, ba hindi yung may ayaw? Okay? Maganda rin po yung pag-isipan. Okay? So sa inyo po, that's my answer. But seniors, please think about it because kayo po talaga ang vulnerable population. Kaya lang, life is too short para mag-away. So I can only give you the information. I cannot force you.
Okay po, Doktora. Ang dami pong bumabati kay Mayor.
Wow, let's read it.
Sige po. From Miss Suzette Francisco Custodio, happy birthday to Mayor J and hi, Dr. Ana.
That lady is my that lady is my hold on 1 second lang. That lady is my Miss Suzette is the mom of the physical therapist and the occupational therapist na in-interview natin. Very smart kids. And she's also my best friend from high school. Thanks Suzette and Jing for the bate. Okay?
Okay, from Mr. Jimika Ganyon Soryaga, good evening, Dr. Ana York.
Hi, sir.
From Miss Cathy Rodriguez, happy birthday to your handsome husband, Doc Ana.
Wow, thanks ma'am. I will let Dr. J know na binati niyo po siya.
From Miss Elsie Miranda Villones, happy birthday sa gwapo naming mayor.
Wow naman, Miss Elsie. Thank you.
From Mr. Lanlan Mesia, Doc, nabalitaan niyo ba yung doktor sa Makati Med na namatay sa COVID dahil kahit naka-first dose na ng vaccine? Thanks.
That person who passed away in Makati Med is my professor and also a friend. Okay, so I know that person personally. Please put first dose vaccine. Okay.
Okay.
What I could say po, no? First of all, ako po naapektuhan personally. Kaibigan ko yun eh. Okay? And my husband did ask that question. Di ba frontliner si sir, sabi niya, hindi ba siya nabakunahan? Well, I did ask that question po sa aming class. And, you know, as I mentioned before, you get your full protection after the second dose, which is 22 days after the second dose. Okay? First dose pa lang po. ang nakuha po ng mga, lalo na if you got Sinovac, second dose ka na eh. But if you got Astra, the second dose is the end of May. So, kasi 3 months po yun eh. Unlike Sinovac na 1 month. So, all of the Astra people are still on their first dose. So, wala pa po silang, ang protection daw ng Astra is 76% after the first dose. Pero, wala pa po sila sa 90%. So that's what I just like to say. If you did get the first dose of the vaccine po, you can still get sick. You can still get very sick. But again, most of the people who na first dose, naging hindi na, moderate na lang po. But again, there are still people with many comorbidities who are older with what are comorbidities, hypertensive, obese, sinabi ko po, male sex, smokers, ganun po. And they can have serious COVID and pass away. So, the doctor who passed away in Makati Med is my friend. He got 1 dose po of a vaccine. And yes, it's still possible. And we are very, very, very sad po sa nangyari. Actually, I almost became a pathologist because of Dr. Joey. But, yung trabaho po nila, pathologist is the one who does the autopsy and they work in the lab. Being much inspired by this really excellent and kind doctor, I also wanted to work in the lab and to do autopsies. In fact, I did a number of autopsies po sa patay, like sa CSI. I almost entered pathology, but my classmate and good friend, who's now an OB-GYN, said, Ana, you're so madaldal and you connect well to people. Sayang yung mo sa pathology. So that's why I became an internist. Okay?
Okay, from Miss Ana York Evasco Beltran. Good day, Ninang. Happy birthday to Ninong. From me, Ryan, Sab, and Sam.
Ayan. Inaanak ko yan. The only other person named Anna York. And her anak is Samantha York. Ayan.
Wow.
Yes!
From Miss, ang galing naman. From Miss Nena Lakap. Happy birthday, Doc J. From JBL Midwife.
Wow. Thanks, Ma'am Nena and the JBL Midwives.
Another question po from Mr. Jimika Ganyon Suryaga. Doktora, pwede po ba magpa-blood test sa sugar after 5 days ako nagpa-first dose COVID vaccine?
Yes, it's okay po. There's really no relationship po between the COVID vaccine and your sugar, so you can get tested po for sugar. Don't worry.
Another question from Mr. Landan Messia. Doc, totoo po ba na nakakatulong yung maintenance sa asthma para di magka-severe COVID? Thanks po.
Ay, Lanlan, I wrote an article on that. I am an asthma doctor. I have had much experience. Yung binabanggit pong drug is inhaled steroids. Sa mga may inhaler, please put the word asthma and steroids. Sa may inhaler po, asthmatics and COPDs, they are maintained po on inhalers. Okay? So, these inhalers, some people take it for years, have steroids. Kasi po parang yes, para pong parang pinakakalma kumbaga. I cannot explain that Parang kinakakalma po yung yung airways po ng tao, so they do not have an asthma exacerbation. Hindi po grumabe yung kanilang asthma. Okay. How did this, and they have done, clinical trial ito sa Italy po. They showed po that once you have mild steroids po, once you have COVID and it is mild, and then you start to use inhaled steroids po, nakita po nila that there is really, hindi po magtutuloy sa severe. Kasi there is a percentage talaga of COVID that will become severe. Okay? Pag gumamit daw ng steroids, inhaled, kahit hindi sila asthmatic, okay, biglang hindi na po magtutuloy to severe. This was a randomized clinical trial. Group A received normal treatment. Group B received normal treatment with inhaled steroids. Hindi po tumuloy sa serious COVID si Group B, the one with inhaled steroids. Actually, I would like more information about this, and I'm hoping that more doctors use inhaled steroids. Kasi if it is indeed, kasi they're recommending pa more study, pero meron ng study. Unlike certain drugs, wag na natin banggitin ang pangalan, na walang study. Ito po, this was studied in Italy on live COVID patients. So talagang tao ho talaga. Kasi sometimes yung iba sa aso or sa lab, ito sa tao talaga. Bakit ho, what was the problem with the study? Tinigil po kasi nagka-surge sa Italy. So nagkakagulo na po doon. They could not recruit any more patients. They themselves siguro nataranta na. So they had to stop the study prematurely. Pero meron na pong pakitang benefit. So in fact, they're suggesting that more pa para mas para mas mapag-aralan pa. Okay? Kung sana natapos nila yung study, that would have been nice. Kaya lang nagkagulo na po sa Italy due to the surge. Okay? So what's the theory behind that? Paano ba nag-umpisa? How did they get the idea of this study? Okay, I really like this study kasi. It came out in the Lancet, which is a UK journal. Ang nangyari po doon, kami po mga lung doctors, okay, nung nag-umpisa po yung COVID, nag-ready na po kami na lahat po ng mga pasyente namin, pag na-COVID, goodbye. Okay? Kasi can you imagine naman, asthmatic ka na, and then hinihika ka, and then na-COVID ka pa. So, we are just assuming diretso ka ng ICU and a large percentage are gonna be serious or even die. And would we think that? Kasi po, during the flu season, the people who die from flu po, talagang, ilista mo na yung asthmatics, at saka po yung mga emphysema, chronic bronchitis, yung mga problema po sa baga. They are really the first to go. But suddenly, we didn't see this in COVID. At ang nangyari po, they didn't know why. And then, lumabas po yung study that dexamethasone, which is a steroid, is helpful in severe COVID. So, yun po yung IV form ng inhaled steroids. So, yung inhaler. So, parang sabi nila, oh my God, maybe these people who have been on inhaled steroids for years, parang naprotektahan ho yung kanilang airways ng COVID. So, that is one of the working hypotheses po doon. Ako po I'm just telling you, if I had a patient who became COVID positive and is hanging out in their house, I would prescribe inhaled steroids kasi it's really, 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 really safe. If you're gonna use it for 14 days na magpa-puff kayo ng inhaled steroids, go. Kulang nga po yung information, yung parang hindi siya pumutok. Well, because maybe it's a cheap everywhere, everyone knows it. But meron pong study.
Okay, another question po. Doktora, ano po ang biopsy?
Ay, okay. This is a nice question also. Can you flash lang biopsy? Ayan. Okay. Bakit nga ba binabiopsy and what is a biopsy? Okay. I'm glad you asked this kasi kung minsan nakaasawa na rin si COVID eh. A biopsy is, halimbawa may bukol po kayo sa katawan, po, and then may nakapa po kayo, or if may nakapa sa breast nyo, sabihin na lang natin, the doctor or the surgeon will tell you, ma'am, kailangan pong i-biopsy ang bukol po sa inyong suso. So what's the meaning of biopsy? Okay? So, usually, ang binabiopsy, mga bukol at mga nakikita po nila na hindi dapat nandun sa katawan nyo. Okay? We usually biopsy the bad stuff. So, what's the point here? The point of the biopsy po is para kumuha ng laman. Kakagat po tayo ng laman. Whether it will be through a needle, nakukuha ng konti. Whether it will be po from, kuminsan kumakagat. There is a, na kumakagat. And then sometimes that is called a punch. Yung needle biopsy is called the fine needle aspiration biopsy. Yung kagat, that's called a punch biopsy. And then sometimes we have bubuksan talaga, that is called an open biopsy. And kuminsan kinukuha talaga yung laman. So pag nakuha po nila yung laman, what will they do? First of all, a biopsy is usually taken when we don't know kung ano po yung hinaharap natin. So we need to get the laman to send it to the lab to tell us kung ano ba yun na kinuhanan natin lang laman. Is it a normal part of the body or it's not a normal part of the body? Most of the time, we do biopsies to find out if we have cancer or not. Though we do biopsy other things just to find out po what they are. Okay? So, yun po yun. A biopsy is to find out, is to get cells or kumuha po ng laman sa katawan or kumuha po ng laman sa isang bukol na hindi po dapat nandyan, dadalhin po yun sa laboratorio. They will look at it under a microscope. It is actually the pathologist who does this. And malalaman po nila, they will tell us, cancer or non-cancer. At kung non-cancer, kung ano po ba yun. Okay? So before, this is extremely important and I would like to let everybody know this. Okay? Bago nila hatulan kayo na may cancer, you absolutely 101% need a biopsy. Never believe anyone who tells you have cancer unless kumuha po sila ng laman. And more, never believe them na you have cancer or that you need to undergo chemotherapy kung wala pong biopsy. Okay? Kailangan po talagang malaman kung ano po yung bukol na nakakita nila before they do anything. Paano sila, anong bibigay nilang gamot kung hindi nila alam kung anong sakit? Okay? The biopsy is one way for us to find out. Ayan.
Okay, another greeter from Miss Bienia Gatos Lacanilao. Happy birthday po.
Thank you.
Kat, I'm back.
Makakaabot.
Okay, I'll be the one to read this one na lang, Kat.
Okay po, thank you.
From Miss Ketlak Samana, what is the difference between mmol per liter and mg per dl? Result is glucometer. Thanks po, I'm diabetic.
Ma'am, ano po we have a metric system and we have an English system. So, sa US po, they use the English system. The rest of the world uses the metric system. So, yung ano po, yung ano po yan, yung milligrams per deciliter, yun po yung metric system. They're actually okay. The Philippines tends to use the metric system. Ako nga nahirapan when I was in the US kasi I was raised in the metric system. I had to adjust myself there. And then, bumalik na naman ako dito, iba na naman. Okay? So, ano ho yan? You just have to, there is a conversion on the internet. There is a conversion table on the internet po. So, yun po.
From one of our board member, Tess Patiag. Happy birthday po, Doc J. Keep safe, Mare.
I keep safe rin. And kumusta yung anak ko? Do they have any kids? Ito lang I wanted to say, just before the pandemic, alam mo bang, Reyna, Diyos ko, anak ni Ma'am Tess Patiag. Kasi kababayan ko si Ma'am Tess in-invite ako maging ninang. Ngayon, because I had 2 weddings on the Sunday before the lockdown last year, I had to go to the one in San Fernando. So nagpaalam ako kay Ma'am Tess and kay Attorney Patiag, who is the head actually, the operations head of PCSO. Sabi ko, Mare, pare, kasi inaanak ko po yung anak nilang isa pa sa binyag. So this is sa naman, sa kasal, So he was getting married. So sabi ko, I am sorry, I cannot attend your wedding. That was March. First week of March last year. So sabi ko, let us eat out na lang. I'll make you libre you guys in Gloria Maris. I chose kasi masarap ang pagkain. And para I can meet my inaanaks and I can meet you guys. Okay? So we ate in Gloria Maris, which was a really nice lunch. Actually dinner After Gloria Maris po, parang, I don't know, I didn't feel well for a few days. So hindi na ako lumabas. And after a few days, naku, Diyos ko, nagputukan na po. The first COVID cases happened in Green Hills Do you remember that, Reyna? It happened in Green Hills. Kasi na-confine sa Cardinal Santos yung mga COVID cases So talaga, oh my God, I was in Green Hills. So sabi ko, oh my God, ang buti na lang, di na rin ako umikot, di na rin ako I just went to Gloria Maris and went home. And after that wedding in San Fernando, then kinasal na rin yung anak po ni board member Patiag. That was the last time po ako yung nagninang. Sabay pa yung dalawang wedding. So yun nga, I went to the one in San Fernando. Wala na pong wedding and lockdown na. So very memorable po talaga sa akin yung encounter ko po with my mare and my pare in Gloria Maris. I hope you're well.
From Mr. June Salud, hi, Dr. Ana York, Bondoc.
Ay, si June is a wedding coordinator. June, kumusta ka? He is from Batangas and a very good friend. Thanks, Sir June. Message ka lang or tanong if you need anything.
From Miss Heidi Vergara Yu Chua, you're a smart and sweet doctor. Not all doctors of the same specialization are like you. Thanks for always enlightening us. God bless you.
Thanks, ma'am. Ang ganda naman. Natouch ako doon.
From Miss Annie Dionisio, happy birthday po to your husband.
Hi, Ma'am Annie. How are you? Good afternoon po. Good evening na. And thank you for the greetings of happy birthday.
From Mr. Edgar Tongol Sichon, Ma'am, happy birthday po, Kang Sir J.
Ay, kamusta kayo, sir? Thank you.
From Mr. J. Umaling Malyari, hi po, Doktor. Happy birthday, Mayor Dr. J.
Ay, Jay is my former employee.
From Miss Tanyeza Celine, good evening, Doktor. Happy birthday to Mayor J.
Mga empleyado ko lahat. That's good. Did you get the pancit I sent you guys?
From Miss Melinda Once, happy birthday po, Doc.
Melinda, happy birthday. And thanks for the greetings that you gave for the happy birthday. Good evening. Thank you.
From Miss Rosalie Sampang, happy birthday po, Mayor, and good day po, Doktor.
Rosalie, thanks so much.
From Miss Ruth Razon, good PM po, Doc.
Hi, Ruth. Kumusta ka? Ayan, may tanong ata si Ruth. Go.
From Miss Ruth Razon, Doc, I was affected of corona last January po. Severe po naging effect sa akin. Until now po is nakakaramdam pa rin po ako ng fatigue. And parang hinihingal po ako minsan. Feel ko para na akong may asthma.
Ma'am Ruth, ito lang sabihin ko sa iyo. It's not well publicized, but there is a phenomena po that we call long COVID. These are people who have recovered from COVID. And my question, na-ICU ka ba? Can you put that down, okay? Long COVID, okay? There are two forms of long COVID ngayon eh. These are what's the meaning of long COVID? People na parang theoretically recovered na sila, 21 days na, like ma'am, 2 months na, pero they're not yet hindi pa sila talaga hindi pa sila talagang it's taking them, they have either parang brain fog, not so clear ang pag-iisip, yung iba madaling mapagod, yung iba hinihingal, yung iba as ma-mentioned, they feel asthmatic, yung iba po it affects their heart rate, their blood pressure, and marami pong nahihilo. Okay? Marami ring nade-depress. So these are all parang long side effects or long effects. So, I mentioned there were two, no? Ito po, the first one is those po na natubo. Okay, what's the meaning of natubo? Na ICU po sila. They were on a machine. And these are people who may have stayed for a long time in the ICU. So, dalawa po yung maging effects nila. One is mental. That's called post-traumatic stress disorder sa mga nanggaling sa ICU. Lalo na ho kung yung dalawang katabi nyo namatay, it's so not nakakatuwa. Or you keep seeing all these, you're wearing oxygen, pero hindi ka patulog. And every like 4 hours, may linalabas na katawan. And then you hear these nurses saying, for cremation na po yan. Can you imagine yung kaba nyo? So, mental, Mental. Plus, your relatives cannot go there. So, it's just really so terrifying. And I'm just hoping the nurses are very kind, okay? So, mental. The second one po is, for people who have been in the ICU, and not only for COVID, but for those who have been lying down for more than 21 days po, meron pong tinatawag na yung atrophy, yung muscles nyo will be so weak. After ICU stay nga po, lalo na po mag-intubate, kailangan ng physical therapy. It can take weeks to months before people can actually walk or run. So, ang dami pong nangyayari talaga sa isang ICU, lalo na kung na-dialysis pa kayo, natubo pa kayo, na-pulmonya pa kayo, lahat po yun. In fact, for people who have had severe happen po after COVID, wait lang ayan, balik. Which can happen after COVID po, for bacterial, up to 1 year, you can have an abnormal chest X-ray and an abnormal cardiac echo. So that's normal. The second ano po na I wanted to tell you about is there is long COVID for people who've had mild to moderate. May mga tao ho na nagiging mild or moderate po yung kanilang COVID at yung mga simptomas and all sorts of things happen after. That doesn't mean they have COVID at nakakahawa, no? But akala mo mild lang yung COVID mo, like napagod ka, pero after 2 months, pagod ka pa rin. So yun po yun. There are people whose symptoms will really linger. What to do, we don't know yet. We are still studying that. My advice to you, just take it easy. Try to keep your spirits up, be positive. Lilipas din po yan. I hope.
Okay, next po. From Miss Leonida Calixtro Dacles, Doc, yung senior na may vaccine ng flu at anti-pneumonia this year, pwede rin po siya magpa-COVID vaccine?
Yes. Actually, marami ring nagtatanong yan. Yes, if you had the flu, you had the pneumonia, you can get the COVID vaccine. Huwag nyo lang hong ipagsabay. Take some time off po. Maybe 2 weeks. Pwede na po yun. Okay? I don't know why people like to magpabakuna daw ng sabay. What is the reason for this? Take time off. Why would I suggest that people, ano kung may side effect yung pneumonia, may side effect yung flu, may side effect yung COVID, baka hindi ka bumangon doon, ano? So, take it easy one at a time. Alamin po natin the side effects of each. Treat your body carefully and with respect. Okay?
Okay, from Miss Yasmin Ocampo. Hi, Doctora. Happy birthday, Mayor Dr. J. Keep safe po. God bless.
Thank you.
From Miss Lanlan M. Messia. Doc, last question. Mag-positive po ba sa
No
COVID
problem. Okay lang.
pagkatapos magpabakuna? Thanks po. Mag-positive po ba sa COVID test?
It is possible. Because, for example, meron hong mga nag-i-incubate na ho yung COVID. Kasi remember, it's only on day 5 that you will start to have symptoms. Let's say na-expose ka on Monday. Wednesday yung COVID bakuna mo. Okay? So, nagpabakuna ka ng Wednesday. By Friday, nilalagnat ka na. Oh. So, you're wondering, paano ko nagka-COVID na bakunahan naman ako? Kailan ka ba na-expose? That was Monday. And then you had your vaccination Wednesday. So, nasa katawan nyo na po yung COVID. And there are also naman people who've had one vaccine and get COVID like a week after. Again, remember, I told you, the vaccine is not to stop you from getting COVID. The vaccine is to stop you from dying. Ngayon, meron din home protection against mild to moderate COVID, but we still do not know po the exact amount of protection. And again, dose 1 pa lang po yan. Meron pa pong dose 2. So talaga pong what is the ultimate lesson here is, even if you've been vaccinated once, you still need to wear a mask and socially distance. And even if you have been vaccinated twice, you still need to wear a mask and social distance. Okay?
From Mr. Edgar Tongol Sichon, yan po ang magaling at masipag na mambabata sa amin, 4th District ng Pampanga. Kamukha ang kanyang kapatid na happy birthday po kayo, Sir J, from Panyulong, Minalin.
I know. Kaibigan ko yan. Thank you so much for the kind words, Konsehal. Thank you so much.
From Mr. Raquel Cuyugan, good PM po, Doktor. Ask ko lang po, kung mataas ang BP, di pwede po ba magpa-vaccine?
Well, what do you mean your BP is high on the day of the vaccine? Sana naman naka-maintenance po kayo. Kasi baka kung 180, dalhin muna kayo sa ER before the COVID vaccine eh. So if you are known to be hypertensive and you are taking po antihypertensives, that's fine. Kaya lang, if you go to the vaccination center with a BP of 180, dadalhin mo muna kayo sa ER for the BP. So my suggestion is, if you are hypertensive, pabakuna na po kayo and do continue to take your maintenance meds. Okay? Rains, last question na po.
Okay po. Miss Kat? From Mr. PC Pants. Shout out, please. Last
Wow,
one,
really
Miss
see big
Kat.
fans. Opo, thank you.
Miss Kat.
Okay.
From pababa. Ito na po ba, Miss Kat? Okay, from Miss Heidi Vergara Yu Chua. Bakit po may kakilala ako nag-negative na sila sa COVID, yet nagstay pa sila sa hospital for more than 2 weeks? Dahil ginagamot pa daw ang kanilang pneumonia. How long pa po kaya sila magstay sa hospital?
Alam mo, this is the ERAP story. Sorry ina-attack lang po ako ng nicknames dito. Kaya mabilis. You can be cured from COVID, but you can have a secondary bacterial pneumonia or what we call po hospital-acquired pneumonia after you got COVID. How did this happen? And this often happens with the flu. Okay? Once you get a viral pneumonia, your body talagang dinalabanan po ito, no? To the point po na humina na kayo ng humina. Unfortunately, the hospital is not a clean place. In fact, there is what we call hospital-acquired pneumonia from ano po wala talagang yung iba, infested na lang yung ICU nila eh. Nandun na po sa tubig eh. So, um, when your body is so weak from having fought off the COVID, naka-recover ka na. Like Erap, you went home, ganun, or you're in the hospital na regular room, ganun po. Madali pong kumapit talaga yung hospital-acquired pneumonia to weakened persons and they really can get very, very sick again. Baka po yun ang nangyari sa inyo. Actually, sa flu po, people don't die of flu eh. People die of bacterial pneumonia after the flu. So, yun po yun. Thank you for joining us tonight. It's been a short but ang daming magandang tanong at saka ang daming friendly batis. To everyone, thank you so much for helping Dr. J celebrate his birthday. I would like to thank everyone again for lahat po ng good greetings and nice wishes. So sa inyo po, ibabalik po namin yung kabaitan na pinakita. Stay safe and healthy po.